Performance Enhancing Drugs, Unit 1.21, Flip Lesson. Throughout this lesson, feel free to pause, rewind, and refer back to previous slides in order for you to be able to answer and complete the tasks laid out. The areas that you need to be aware of with regards to performance-enhancing drugs are anabolic steroids, narcotic analgesics, stimulants, peptide hormones including EPO, diuretics, and beta blockers. Anabolic steroids. Anabolic steroids mimic male hormones, increase muscle mass and develop bone growth. As a result of this, it increases the individual's strength and allows the athlete to train harder for longer. It produces results quicker. However, there are a number of side effects of taking any performance-enhancing drugs, and those of anabolic steroids. It can cause things such as liver disease, increased risk of muscle injury, high blood pressure, and infertility in women, and in the worst case scenario, death. Beta blockers. Beta blockers are normally prescribed by a doctor to maintain low heart rate and a lower blood pressure, particularly with those who suffer from a high blood pressure and high heart rate. However, performers have started to use these in sports such as archery and shooting in order to reduce their stress levels and anxiety, thus resulting in a greater steadiness of their hand and precision when performing. The side effects of beta blockers are nausea and diarrhea, insomnia and nightmares, depression and tiredness. Narcotic analgesics. Narcotic analgesics are used for players or performers where people have been injured. The narcotic analgesics mask the pain by depressing the central nervous system and give relief to painful injuries. It allows an athlete to continue to compete even when injured. However, the side effects are loss of concentration, loss of balance, loss of coordination, emotional effects such as hallucinations. These are in particular in relation to morphine. Stimulants. Stimulants increase the alertness, enabling people to think more quickly. This is done by stimulating the central nervous system. Increased aggression, helps overcome tiredness, and helps in the offset of lactic acid. The side effects of stimulants are insomnia, irritability, addiction, irregular heartbeat, high blood pressure, and increased heart rate. Peptide hormones and EPO. Peptide hormones and EPO. HGH is the human growth hormone. It has the same effects as steroids. Then EPO allows a build-up of red blood cells. These red blood cells can increase the amount of oxygen is carried around your body and disperse waste products and lactic acid quicker, allowing you to compete at a high level for a longer period of time. Diuretics. They increase the amount of urine, speeds up the elimination of fluid from the body, and helps lose weight quickly. It reduces the concentration of other banned substances that might have been taken. One of the long-term effects of taking diuretics, it can cause kidney problems. Short-term, however, dehydration that leads on to causing dizziness, muscle cramps, headaches, and nausea. Here is a multiple choice question. Despite the risks, some performers take drugs to improve their performance. Which one of the following statements correctly links the performance-enhancing drug with its effect and the performer who can benefit from this effect? If you look at the question, you need to identify some key important information. For example, which one? We are only selecting one. Of the following statements correctly links the performance-enhancing drugs, again, important, with its effect. If you look at peptide hormones, is the effect of taking peptide hormones reducing anxiety levels? Stimulants, does this cause increased aggression? Anabolic steroids, does it speed up weight loss? Narcotic analgesics, does it increase the oxygen delivery during a long distance event? Going back to some of the previous information, you will realise that only one of these is linked to each other: stimulants and aggression. Therefore, the only answer could be B. Moving away from the multiple choice questions, we are now looking at some 2-mark questions. Again, important that we read the question to establish what we need to find out. First of all, we are looking at the drug diuretics. Therefore, we need to know all the information about diuretics and no other drug. It is indicating it is also a performance-enhancing drug. You have to identify and name a sport where a performer might be tempted to take this drug and explain how it might be used to improve performance. The first thing you need to ask yourself, what is diuretics and how does it enhance performance? First of all, we can establish that it is to do with weight loss. We then need to establish the sports that may use diuretics in relation to weight loss. These sports are generally sports which will require you to be a particular weight to fit into a category or to actually compete in the event, such as a jockey or boxer. Once we have established this information, we then need to explain why and how this might improve performance. If a boxer needs to fit within a weight category and it is taking diuretics to lose weight in order to get into that weight category, it may well be performing in a category that is lower, and therefore other performers may well have a lower muscle mass. If this performer has taken diuretics, it would then allow them to fit into a lower category but have a higher muscle mass, therefore have an advantage to be able to throw a harder punch in a match. What I'd like you to do now is to see if you are able to come up with your own example of why someone might take a diuretic. Moving on to part B, state 2 negative effects of taking diuretics. Again, we are looking at key information. We need 2 pieces of information and they need to be negative effects of taking the drug diuretics. These are classed as the side effects. These are not aspects that enhance their performance, but what is the negative impact on a person of taking these drugs? Can you think of them? If you are struggling to identify the answer for this, please move the video straight back and look at the section on diuretics in order for you to be able to answer this question. Moving on to 2 3-mark questions. Despite the risks, some performers take drugs to enhance their performance. In the table, identify 1 possible health risk of taking each performance-enhancing drug. This is where you need to know what the side effects of each drug are. So we have diuretics, anabolic steroids, and narcotic analgesics. In these sections, please ensure that you only write 1. You do not need to complete an essay. For example, a health risk of diuretics would be dehydration. This obviously leads to other things, but dehydration is sufficient for you to gain the mark. Are you able to complete the other 2? Using an example, you need to explain. This is where we go from simple statements into developed statements. The question is, use an example, explain why a performer might risk using beta blockers to enhance their performance. Again, you need to know the key information about beta blockers. Think about the sport that it might be used in. Remember, this is archery or shooting. Can you now remember what advantage there is to using beta blockers in these sports? The effect of taking beta blockers, it reduces the heart rate and therefore anxiety and stress. How does this link into archery and shooting? Now, go ahead and answer the question. You will now need to complete a series of 5 questions. These questions will need to come from all areas of performance enhancing drugs. Please remember that you need to consider questions with simple statements and developed statements. They need to be a value of 1, 2, 3 or 4 marks. Also, look and refer back to the information given so far. These questions will need to be handed in on Monday's lesson.